I could post it on YouTube later on. So welcome to the next lecture. And I believe in your previous session, you have finished the nerve tissue. That means so far we have covered the whole general histology. That means epithelial tissue, connective tissue, muscle tissue, and nerve tissue. And can you see my presentation here with the welcome slide?
Yeah.
Okay. So today I would like to give you some feedback on whether you are able to use that information in some simplified to solve some simplified problems that have been modified for first-year students. And at the end of this lecture, if there are students interested, I can give you a taste of the procedure we have prepared for the credit exams. Okay. And if there will be some volunteers, you can go through the process with me, and the other students could observe. Okay, just to try technically how it's organized. So please, if you visit this page to post your answers, I have prepared some short review regarding the nerve tissue from your previous class. So if you go to this web address or use that QR code, and there is the first question waiting for you. The arrows are pointing to some nuclei. And my question is, what could be the cells the nuclei belong to? And to make it even more simple, here you have a scheme, a sketch of those cells, suggesting the context. So if you have any idea, just why don't you type it in? I will wait for few responses, and then we check it. So these clear nuclei with the light euchromatin. So let me check the first responses. So yeah, most students believe it's an astrocyte. That's perfectly correct. And we could be even more specific if you consider what type of tissue are we looking at. It's nerve tissue, obviously, but is that gray matter or white matter? And somebody said it's fibrous or fibrillar astrocyte. That's correct, because how do we know? Because this is obviously white matter. We don't see any cell bodies of neurons here. We see just the network of nerve processes here that's called neuropil, and we can see the glia cells, and those with the clearly outlined nucleus and pale chromatin, these are astrocytes, and if it's white matter, it's fibrous astrocyte. Okay, well done. We go to next problem. Now name these cells. And again, you have the scheme of this. So how to approach this problem is that you should realize that you are looking on the gray matter somewhere in the central nervous system. Yeah. How do we know? Because you can see these cell bodies of neurons, such as this one, this one, this one, or this one. The neurons are the cells where you can mostly see the cytoplasm, okay? Otherwise, we have also the glia cells, the neuroglia cells. These are these nuclei without surrounding cytoplasm. And again, it's the pale one that belongs to an astrocyte. But this time, if it's in gray matter, it must be a protoplasmic astrocyte, as many of you suggested. So I'm glad you know this. Okay, another task. Now we focus on these cells with somehow darker cell nucleus, with a compact round-shaped nucleus. Again, you have the sketch, a drawing of these cells, even with the processes, right? You can't usually see in the routine sections. So what's your opinion on these cells? Let me check your responses. So you're suggesting it's oligodendrocyte. I completely agree with that. It's oligodendrocyte, but it's oligodendrocyte in the gray matter. How do I know? Because you can see this huge pyramidal shaped neuron that suggests the cell body of it that suggests we are in the gray matter. Yeah, this is a neuron as well. So we must be in the gray matter. Okay, another question. Now we're pointing to that slightly compressed cell nucleus that occurs here, and here we have a sketch of that cell. So some students believe it's microglia. I would agree with that. That's how a resting inactivated microglia looks like. It's a cell that originates from precursors derived from circulating blood monocytes that are entering the central nervous system and then become these microglia, the cells that could be later on activated during an inflammation and become part of the immune response because they can turn to tissue macrophages. When they become bigger, the nucleus becomes larger, they will express many lysosomes, and they will perform phagocytosis and present antigens. So these are resting microglia. Okay, that's nice. I appreciate you know that. Another cell, now we're pointing to these small cells surrounding this large cell body. So what could these be, possibly? I'll let you think for a moment. It would be nice to have more responses. This is a typical histological picture of some neuron that occurs in one of the organs. It's a very characteristic shape of the cell body and this process. So I can see you believe it's satellite cells surrounding the neurons of peripheral ganglia. That's perfect. That's perfectly correct. Some students believe it's ependyma cell. That's not correct because ependyma is lining of the cavities of central nervous system. But these cells are glia cells, and this is a pseudo-unipolar neuron, the cell body of it, with the dendroxin, with this common process. And this cell body can be found in the spinal ganglia. So this is a sensitive neuron, the axon of which becomes part of the dorsal roots of spinal nerves, entering the dorsal horns of the spinal cord gray matter. And these glia cells are called satellite cells because they really look like satellites. Okay, next one. Sorry. Next one. You can see two histological sections through a peripheral nerve. I wondered if you can notice some difference between those, and just ignore the fact that this one has a wavy appearance because that's a result of the post-mortem contraction or of the tissue, and this one has been cut in a stretched condition that did not allow this post-mortem kind of contraction. Yeah. Look on the composition and the histologic appearance. Is there something that we can make a conclusion from? Is there some difference between these two nerves? Some difference that could be relevant to the function of the nerve. That's actually why we care. Yeah. So perhaps you have noticed there is some white substance here. There's a larger proportion of this white substance on the right than on the left. That's exactly what I need you to remember and to understand. So some students believe we can see Schwann cells. Yes, we can, but in both cases, yeah, these nuclei most probably belong to Schwann cell that are forming the Schwann's sheath surrounding the axons and dendrites that are running here. But the point here is actually the myelination, yeah, that some of you mentioned. This white substance that surrounds the nerve process, this white substance here, it's myelin. It's white because it's mostly made of lipids, and you can't see as much myelin here as you can see on the right side. So on the left, that's a histological picture of an unmyelinated nerve. That's one with a slow propagation of action potentials, approximately in meters per second. And on the right side, you can see a myelinated nerve with the saltatory propagation of action potentials. That's much faster, right? Approximately 100 meters per second. So remember the difference between unmyelinated and myelinated nerves. Okay. Oh, yeah. Now, my next question is about the blood-brain barrier. So every student should be aware of the fact that the neurons are not directly exposed to the blood plasma or to the tissue fluid that is filtered from brain and spinal cord capillaries, but there is some barrier separating the blood plasma from and the neurons. Now we care about the histological layers. What is the barrier made of? So try, and if you don't know the complete description of the barrier, like all the layers, name at least the layers you remember. I need to know if you know, okay? So far I can see two results. Let's check these. So some students believe there is some epithelium. Actually, there is no like real epithelium, but there definitely is the endothelium of capillaries. That's one of the layers. Indeed, the basal lamina that is below that endothelium, endothelial cells, and the astrocyte processes. Okay. And the processes of the astrocytes are also called the perivascular glial limiting membrane. Yeah. Okay. The limiting membrane of the perivascular glia, that's the process of the astrocytes. That's correct. Let's revise the scheme of this. So here is the capillary, and the neuron is not on the scheme. It would be somewhere else. But every molecule that needs to pass from the bloodstream to the neurons of the brain and spinal cord needs to pass the following barriers. First, the endothelium of the capillaries. Now, these capillaries are the least permeable capillaries in the human body. Yeah, some organs like brain or lungs have these capillaries where the spaces among the endothelial cells are sealed with tight junctions, not permitting any molecules to pass through the slits among the cells without proper selection. So the cells actually decide which molecules will be transported through. The process is called transcytosis, because here there is pinocytosis of cell of lipid droplets, and there is exocytosis on the other side, transcytosis. The other layer is the basal lamina, the endothelium sits on, and the third layer are these food processes of astrocytes. And as they make an almost complete envelope, it's called the limiting membrane of the perivascular glia. Yeah. Okay, so that's the barrier. Why do we care actually? Because let's say you will need to deliver some drug to neurons, or you will need an antibiotic to cure an infection in the central nervous system. You need to pick uh, the molecules that are capable of passing through that barrier. Yeah? Not all antibiotics can actually enter the nervous system because there is this barrier. Or conversely, sometimes you want to prevent some molecules or drugs to enter the central nervous system. Perhaps you might know drugs called antihistaminics. People suffering from allergy are being administered these drugs, are taking these drugs. And the first generation of antihistaminics, like 30 years ago, the molecules did pass through the barrier because the molecules were lipophilic. Yeah, lipophilic substances more easily pass through this barrier. And the people who were taking these drugs against allergy, they were so tired, sleepy, they could not drive a car. They were forbidden to drive a car because of that. Now we have advanced generations of antihistaminics where the molecules have been modified that way that they do not mostly enter the central nervous system. So that's understanding the barrier, and this is the real picture from electron microscope. So you can see the lumen of a brain capillary. This is the nucleus of the endothelial cell, and this is the food of the astrocyte. This is the pedicle of the astrocyte, and here is the neuron. Of course, it's 3D, so you can see only a section through that, but there are definitely some layers between the capillary lumen and the neuron. Now we proceed to another barrier. Now it's the barrier between the blood and cerebrospinal fluid. Again, try to name some or all the layers that separate the blood from the cerebrospinal fluid. I mean the histological layers. Again, we just care for histology in this lecture. Okay. So are there some cells that are separating the blood from the cerebrospinal fluid? Well, these two fluids have a different chemical composition. The doctors should be aware of this. So we definitely expect our students to understand which microscopic layers are between these two fluids. So let me check. I see some first responses here. Let me check it so we could proceed. So it's fenestrated endothelium. Yeah, it's endothelium of the capillaries of the uh, uh, now I forgot the name of the structures. Yeah, the choroid plexus. And then there's the loose connective tissue of the choroid plexus and the ependymal cells. Excellent. So again, this is the picture and the real scheme. Uh, this is a brain ventricle, one of the brain ventricles. We can even guess which one because we perhaps recognize this organ. We can see 1, 2, 3 layers of the cortex with the huge neurons in the second layer of the cortex of this organ. This is obviously cerebellum, okay? So this must be the 4th brain ventricle. And you can see the histology of the choroid plexus in a small magnification and here in detail. So you have the capillaries here, connective tissue, and the ependymal cells. The ependymal cells have a shape of simple cuboidal epithelium on the surface of the carotid villi. And here already we have the cerebrospinal fluid. So it's actually these 3 layers. Why do we care? Because you should remember that this barrier does not let many proteins pass through. So the cerebrospinal fluid, when compared to the blood plasma, has a low protein content. There are also less lipids and less glucose. And this is compensated by more electrolytes than in the blood plasma. So if you will investigate some or measure concentrations of some molecules, there you should have in mind that the reference values would be different than those in the blood plasma. And if you, for example, find proteins, high concentration of proteins in cerebrospinal fluid, it indicates there must have originated from the nervous system, for example, during infection or inflammation of the nervous system, where proteins or pro-inflammatory proteins are produced. So that's how this is practically used. Yeah? And again, this is the scheme showing the blood-brain barrier, endothelium, basal lamina, and perivascular processes of astrocytes. And here comes the neuron. And this is the blood cerebrospinal fluid barrier in a scheme. The capillary, the endothelium of it, its fenestrated one, loose connective tissue, and the ependymal cells. Well done. So now we go to some problems and case studies. Why do we include this class into our regular classes? Well, every student can read, so you can read the lectures, and you can read the chapters in the textbooks. But what we care also about is if you can use that information for solving some even simplified kinds of problems, because that's what your medical training will aim to. You should become qualified professionals that are able to make decisions, make qualified decisions, filter out what is important, what is not, find out the correct information, and so on. And I would like to or if you could, I would like to try an experiment. I have in the chat, I have posted a link that it should open this presentation to you. So please go to chat and try to open that presentation, the one you are looking at, because in the next step, this screen will disappear to you, and I would like to split you in some smaller groups, and always I will present you a problem, but you need to look at the problem on your own computer screen. So use that link. Let me know if there is any problem with that. And now I will split you into groups. I believe we have like 24 students, so it would be nice to have, for example, 5 groups. Okay. And you will always have some 5 to 7 minutes to discuss the problem among you. Here are some rules to make it as beneficial as possible for you. You can use any resources. You can Google things out, use the textbooks, okay? Discuss it with each other. Try not to guess the correct answer, but make the effort to elaborate the answer. You can divide the work as you wish and choose a speaker who will pose the answer for your group once the time limit is up, okay? And discuss it between yourselves. And I will also visit your groups, and you can call me if there will be some problems you need my help with. So if you're ready, I will now create these rooms. So there will be, there will be 4 rooms with 5 to 6 students in it. So you should see kind of invitation now to join these rooms. And once you join these rooms, you will not see my presentation, but you will see it because I have sent you the link to it. So you need to open it on your computer. I will give you a minute or so.
Okay.
Hello, everybody. I've just joined your group for a moment just to check whether everything works correctly. The first question is about
26
the old
years.
woman. Sorry?
No, nothing.
Does it work? It's slide number 18 in the presentation.
Yeah, the text says a 26-year-old
Yeah,
woman.
exactly. Exactly, it is. So technically, it works. You can work among yourselves, and
Yes,
once you're ready, just invite me. You should see a link like inviting teacher or ask for help,
Yeah,
or something
I
like
can
that.
see.
Once you're ready, let me know. Okay.
Okay.
I will check the other groups now. If okay.
Okay,
All
thank
right.
you.
Yeah. So goodbye for now.
Goodbye.
Hi, everybody. I just joined your group for a moment. Please unmute your microphones and talk to me or talk to each other. I want to make sure if everything works for you technically. If you can open the presentation, it's slide 18, I believe, and there's the first question speaking about a 26-year-old woman who is known to be 6 weeks pregnant and so on. Is everything okay?
Yeah.
Okay, so now you are supposed to discuss briefly which of these options, A, B, C, D, E, will be the single best answer. And once you ready, you should find a link in your presentation, like in the Zoom, like ask for help or invite teacher. There's something like that.
Yeah, got
You
it.
see that?
Ask for help. Yeah.
Yeah. So once you have your vote for your group, invite me and we can discuss if it's correct or not. Okay. So I will let you work now. Do you have any questions?
No.
No. Okay. So
No.
goodbye
Okay.
for now. For now.
Okay.
Hello, everybody. If you can please unmute your microphones, so you could talk to me or talk to other students. I want to make sure if everything works for you. If you can open the presentation, it's on slide 18, I believe. And there's the first problem starting with a 26-year-old woman who is known to be 6 weeks pregnant and so on. And there's a picture and asking you which structure performs which function with the 5 options. Can you see that, or does it work for you? Or is there any technical problem? Just let me know. Because now you're supposed to discuss things together, and once your whole group will make a decision, you will click on the link like ask for help that is in the Zoom window, and they will invite me in, and you will tell me what your result is. Okay? Any questions, any problems? Tell me now, please. No problems?
I don't think so.
Okay. So I will leave you for now.
Wait, sorry. I have a technical problem. I don't know where the chat is. I can find the.
Okay, so I can see, there are some problems that students that have not joined the groups, perhaps. So, for example, who is that? Chris, okay? Are you a member of some of these students groups or rooms that I've opened? Yeah, you should be in the room number 3. And you can't see it because you are supposed to use that presentation I have posted a link to in the chat. Again, can you see? I'm posting it again. Click on this presentation and open the presentation for yourself. Because once you have entered these discussion groups, the mighty presentation disappeared. I know that. That's exactly why I have posted a link to you so you can open the presentation for yourself. Is it okay?
No, I can't open it.
Really?
But I don't know why.
I'm sorry for that. So if there will be students with technical problems like that, I will return to the broadcasting for all students. Yeah, I just wanted to try that. You are like my first students I'm trying this with, and if it doesn't work, or just stay tuned for a few minutes, and after the first round, I will go back to the original presentation, and you will see everything, and we will discuss everything together. Yeah, if it's okay. If it's okay. Sorry for the problems. We can solve it out. Just stay tuned for a few minutes. Okay.
isn't it just possible maybe that I could share the screen for this group?
Yeah, that would be great solution. Yeah, if one of you can share your screen within your group. That's perfect. And if that makes you, is that a solution, Chris? Okay.
Yes, I can see it now.
Okay, great. So now you can discuss things among yourselves. Once you're ready, click on the ask for help. It will send an invitation to me as a teacher, and you can tell me your conclusion. Okay. So goodbye for now. I wanted to make sure that it works. Okay, so I'm back here. You can also share the presentation among you if you wish. One of you can share the presentation to all the others. Can you tell me what's the answer?
So we chose the synthesis of steroid hormones.
Yes, and what organelle is that? Which organelle is on the picture and being responsible for this synthesis?
Corpus luteum.
That's an organ the tissue sample has been taken from. But the question with the yellow point points you to a specific organelle within the cell.
Honestly, I can't understand which organelle is it.
Okay. This is to, yeah.
Is it maybe the endoplasmic reticulum? I don't see it really. Good.
Yeah, it's endoplasmic reticulum, but it's a smooth endoplasmic reticulum.
Okay.
So this is for you to remember that the smooth endoplasmic reticulum is responsible for synthesis of steroid hormones in cells in the human body that are professionally producing steroid hormones, such as cell of the corpus luteum, right? That's all. You got it. Okay.
Great.
I go to another group. Hi. So did you come to a conclusion? I believe you can also share the screen within your group if that facilitates your discussion. Yeah.
Okay, I try.
So what's your opinion?
Yes, we think it's the smooth endoplasmatic reticulum we can see because there the hormones are produced, and in the pregnancy we need like steroid hormones like progesterone
and estrogens, exactly. So yeah, you can see these vesicles, but they don't have ribosomes on it. So that's smooth endoplasmic reticulum, and it's an organelle devoted, for example, to synthesis of steroid hormones. So cells that are pretty good at producing these hormones have well-developed smooth endoplasmic reticulum. And that's it for you to remember, that the corpus luteum is filled with cells producing large amounts of male sex hormones, female sex hormones like estrogens and progesterone, which are steroid molecules by nature. Great. You can go for another question, and I will talk to other groups just for now.
This one?
If the antigen enters the body and things on the antigen or an IgE receptor, then the mastocytes degranulates his granule, and there is, for example, histamine or heparin in it.
Hi, everybody. I just want to make sure if everything works well for you, or if there are any technical problems.
So what we have to do is look at question 4 and explain it afterwards, right?
Yes, you can. Have you already looked at question number 1, 2, 3 at the previous, or did you directly go
we were thinking about what exactly our task is, because
there is always a short problem on the top, and then you have 5 options, and your task is to discuss what the single best answer could be. Yeah, and after you make a decision, you go to the next slide where you can actually see the correct answer, right?
Okay.
And there are 1 or 2 more extra slides with some explanation, because sometimes students need to understand why this was the single best answer and so on. And I just
Okay.
wanted to make sure if everything works for you. By the way, students from other groups advised me that you can one of you can share the screen within your group if that facilitates your discussion, because then all of you are looking on the same slide.
Yeah.
So if
Yeah,
one
okay,
of
we
you
can
can do that. So if everything works technically for you,
Yes, it does.
you can call me anytime. There is a button somewhere in the Zoom with the ask for help.
Ah, yeah, I see
Ask
it.
for help.
Found it.
That's a button you can call me with if you need something. I can join your discussion again, help you with anything you need. Okay.
Okay,
So
perfect.
if if all works for you, I will go to other students. So bye for now.
Yes, thank you very much.
Thank you. Bye.
Yes.
Yes.
Zbyněk syndrome and so on.
Hi, just to shortly join you, you can proceed with the next questions, with next problems in the presentation as you wish. You can always find the correct answer on the next slide, perhaps a short explanation, and then you move forward, okay? Does everything work for you?
Yeah.
No help needed? Okay.
Yeah.
So carry on, please. Hi, it's me. So you have probably worked to the solution, yeah?
Yes, for the first 3
Okay.
questions.
So great. So you have found out you can always find the correct answer on the next slide. Sometimes there is a short explanation to the problem, and then you can move to another one. Yeah. So call me once you are close to the end of the presentation. There are still some more problems waiting for you, or if you need any consultation or help. Any questions so far? If not, you can carry on, or okay?
Okay.
Okay.
What was the other one? Glands?
And this one, the C.
Maybe look for mucous glands.
No, it's fat, adipose tissue. It's
No,
I think it's
different.
adipose tissue.
Probably, yeah.
C is granulocytes.
Yeah,
Isn't it?
right.
Yes. Okay, here's the process.
Okay.
Okay, that's fast.
Yeah. How can I help you?
Yeah, I think we are ready
Uh-huh.
for the next answer. We think that it's E, recurrent respiratory infection.
And which slide are you on? If you can share your screen within
yes.
this group, so I can see where you are. Where are you? Okay. Yes, obviously it's correct. And if you go to another slide, you can follow a short explanation why is that and why the other options were actually not the best choice. Yeah, these all are existing problems, but without connection to cynocelia problems. In medicine, you call something a syndrome when there are more symptoms caused by the same cause or by the same reason, and you know the cause of all these syndromes. Then together you call it a syndrome, and you can see it affects mostly organs with the ciliary epithelium. So if you know from histology where the ciliary epithelium is, it explains a lot. Okay. Well
Okay,
done.
and so just a short question.
Sure. That's why we are here.
We have in the ear also cilia. I know stereocilia, but cilia?
Yeah. It depends on when in the ear are you talking about. If you're discussing this refers to the auditory tube that connects the nasopharynx with the tympanic cavity. That's where you have a pseudostratified columnar ciliated epithelium, and if the cilia don't work, and the mucus is not transporting there, the transport of the mucus is suffering. Okay, so you can get even repeated respiratory infections of the middle ear cavity. But perhaps your question was about the inner ear, the hearing receptors, the so-called hair cells, and they have many stereocilia, and they also have a kinocilium, which is involved in the hearing process, but is a deformation of stereocilia, yeah, by the movement of the tectorial membrane and the basal membrane. The hearing cells are in between these two membranes, and the vibrations of these two membranes are deforming the stereocilia of the hair cells in the inner ear. These are the actual hearing receptors. So these are in other cells.
So there will be a chronic otitis of the patient?
Yeah, or repeating inflammations of the middle ear, which is the otitis media, yeah, in Latin. Exactly. There could be fertility problems because you have this ciliated epithelium also in fallopian tubes. Okay.
All right, thank you.
Well done. So I will break this rooms shortly in few minutes, so we could come to some conclusion all together. We will return back. I'm happy it worked for you, this kind of discussion, but I will summarize it for everybody. Yeah.
Yeah, great.
So we will shortly, we will carry on all together. I'm happy you tried this working in the groups. We're waiting for a few more students to join us. Okay. So welcome back. I hope you can hear me. And if you can see, if you can still see my presentation now, I'm happy you tried working with the groups. Can you see the presentation now?
Yeah.
Yeah, okay. So I will briefly go through this. I don't know how far you get. I know various groups worked. Some worked fast, some did not. So why do we do this actually? I wanted you to discuss the histology among you. I wanted you to try to how it could be to use the knowledge you got sometimes somewhere in the textbook, in our presentations, if you are able to use it to solve some simple problem. Well, these are not real life problems. These are like problem toys that are supposed to stimulate your thinking, but they will give you a feedback if you really understand the stuff or not. So the first one was about remembering that the smooth endoplasmic reticulum is the organelle responsible for synthesizing steroid hormones, and the steroid hormones are produced, for example, in the corpus luteum, yeah, which is a important endocrine organ in the cortex of the ovary that produces estrogens and progesterone. You can see this. That's it. And it might contain cavities, pathological cavities called cysts. Here is one of the cysts on the ultrasound. Here is on the as seen by during the endoscopy surgery. The second question, if you got that, was about thinking, identifying these structures, which are obviously cross sections through kinocelia, and you should know the distribution of ciliated epithelium in the human body. And if you know this, that from all these options, the best answer is expecting repeating respiratory infections, because the mucus in the respiratory passages could not be transported, and therefore allowing for growth of microorganisms in the respiratory passages. And that condition really exists. It's called ciliary dyskinesia, because you are lacking these the activity of these molecular motors that are responsible for movement among the pairs of microtubules. The molecular motor is called dynein. Another question was about a woman who has blisters on the trunk. You know, she had it even in the mouth cavity. The blisters appear inside the epidermis, and you know that it's caused by antibodies targeting some structures that you have a list of which. So here, this condition, again, it really exists. And if during this disease, antibodies against desmogleins, which are proteins of the desmosomes, if these antibodies are targeting these structures, the desmosomes disintegrate. And as a consequence, the cells of the epidermis in the stratified squamous keratinized epithelium develop these cracks, blisters. They are filled with tissue fluid, and it's a painful condition that results in forming of ulcers. It could also affect the gingiva or the mucosa of the mouth cavity. Okay, and the condition is called pemphigus. You will hear about it in pathology later on. and in dermatovenerology. So for histology, we want you to remember that desmosomes are really important for connecting the cells together. And you can see the most damaged layer here is the stratum spinosum of the epidermis, where the desmosomes are especially well developed. Now another problem asks you where this picture may come from. So it's testing whether you are able to classify the epithelium. So you should look like you should probably think like this. Oh, we can see more nuclei in different height from the basal membrane. That's a definition of pseudo-stratified epithelium. Okay, it's one layer of cells, but there are short cells and tall cells. All they are touching the same basal membrane, so you call it pseudo-stratified. The cells are columnar, therefore it's pseudo-stratified columnar epithelium. And you can see these processes of on the apical membrane. There is a suggested branching pattern here. So this must be stereocilia. Now, which of these organs have this epithelium with stereocilia? Yeah, it's epididymis. Is the body of the epididymis where you have the epididymic duct. This would be sperm cells and macrophages here. Another question, and I know some groups did it to this question, is that there is a young girl presenting to a doctor with these problems with flushing, urticaria, itching, or pruritus, which is itching. She is feeling dizzy, she has difficult breathing, and you know it happened after an insect bite. She's been treated somehow, she's okay, and now you need to identify which cells might be the cause of these symptoms. Yeah? So you need to identify correctly the cells, and you need to understand which of these could be related to these symptoms. So if you looking about these cells, these are obviously plasma cells, producers of antibodies, not related to the symptoms. These are fat cells, yeah, and adipose tissue, not related to the problems. This is difficult because these are macrophages. Tissue macrophages may have different shapes, forms. They are highly variable, but again, not related to the problems. These are connective tissue cells, namely fibroblasts or fibrocytes, not related to the problems, but these are mast cells that can release granules with heparin and histamine. These mast cells typically occur in the vicinity, in the neighborhood of blood microvessels, because they are affecting the diameter of these vessels and the permeability. And once the mast cells are releasing their granules, that's how they appear in routine stains and under electron microscope, they can release substances that are promoting inflammation in the tissue. And they are really linked to type 1 allergy. That's the type of allergy that is triggered by the antigen bound to class E immunoglobulins. The mast cells have receptors for. So if this chain is connected, the cells react with releasing of the granules, and we need you to remember from now to forever that this histamine will cause a massive leak of blood plasma into the tissue fluid. So that makes the edema and swelling, and also dilation of the blood vessels, vasodilation. Okay, and that's where the symptoms can come from. Even the symptoms could be local during the insect bite, or they could be systemic response, and that's what doctors are afraid of. Because if all the blood vessels wherever in your body become dilated, that is a problem. Because the volume of the circulating body fluids, the blood plasma, is lower than the overall capacity of your blood vessels. So if your all blood vessels would relax like that, the blood pressure dramatically drops, and you can lose consciousness. You can have a systemic response that could be fatal. So that is called anaphylactic shock. That's the most extreme version of this reaction. And some people are prone to that reaction, okay? So remember, the mast cells occur in the neighborhood of blood vessels where they affect their behavior. Another problem was very simple, actually asking where this picture comes from. So the key to this is to understand what type of tissue is on the picture. Is it loose or dense, collagenous connective tissue, or what? Here you have the key, and from all these options, you should be able to judge that it's a dense connective tissue. Why? Because you can see that the extracellular matrix fibers prevail. They form the majority. That's the type 1 collagen. They prevail over the cells and the ground substance. So it must be dense collagenous connective tissue. And this appears in the dermis and in tendons. However, this obviously is a regular type of that connective tissue because you can see a prevailing direction. All the cells and collagen fibers are arranged in one prevailing direction. That makes it dense, regular connective tissue, which appears in tendons, not only in the triceps surae muscle, in the Achilles tendon, but in all tendons and ligaments in the body. So this is just to revise this fact. Another problem is a prolapsed mitral valve and dilated aorta in a boy. Other problems such as arachnodactyly and pectus excavatum, which is a condition where you have like a deep impression and deep deformation of the chest. Now I want to ask you if there is any group who did it to this question.
This is the Marfan syndrome or EDS syndrome.
Great. And now I have a different voting system. You're right. You should be able to see some voting, and I want you to start to make decisions again. Now we're discussing all together. So try to pick the single best answer from these options. Which fibers of the connective tissue could be blamed for this association of problems? I will give you a minute or so. I can see how many students already voted, so I will wait until at least the majority, more than half the students will pick their vote. And that's actually why you need to remember the importance and metabolism and occurrence of elastic fibers from our first year histology. Yeah. Okay, so I can see most of the students have already voted. And if you find this difficult, that's perfectly okay, because sometimes students are just satisfied with reading the information in a book, and that's not enough if you want to become doctors, right? You need to test yourself. Am I able to make a decision based on this knowledge or not? Yeah. Okay, so I will close the polling. We have more than 70% of students. I will share the results with you. Perhaps you see this now. Okay, and most students voted for A, which is correct. And it's a condition based on the mutation of a gene coding fibrillin. Now, the fibrillin, you should know, the fibrillin are these fine fibers surrounding the elastin protein core, and they are responsible for maintaining the structure and the microscopic arrangement of the whole elastin fiber. So the black substance is elastin, and these are the fibrillin microfibrils. Again, this is elastin, and this is fibrillin. Altogether, it's called elastic fiber. Here you can see the collagen microfibrils. Here it's a growing elastin fiber where the fibrillin prevails and the black elastin is still being formed. This is especially in young individuals. As we age, we are losing the ability to produce more and more elastin. And why do we care? Because this mutation affects the metabolism of elastin, and surprisingly, it affects many other structures. You have these long, like spider-shaped fingers. It's called arachnodactylia. You have heart valve problems, and mainly the elastic arteries are affected, such as the aorta, that relies on amounts of elastin, makes it able to absorb the systolic pressure peak that comes with every heart cycle inside the aorta. So without elastin, the aorta cannot resist that repeated loading, that repeated pressure peaks, and becomes dilated. And this could be fatal for the individual because it could lead to a rupture of our aorta. So that's why in first year histology, we want to teach you there are lots of elastic fibers in the aorta, because if they are not, there could be severe problems. Well, the lack of elastin leads to also extreme mobility of fingers and flexibility of fingers, which is illustrated in this famous violin player, Niccolo Paganini, who was presumed to suffer from that condition, right? Making him able to make incredible movements on the fingerboard of the violin. So another problem. If you've got questions or problems, just type it into chat. I will get back to it at the end of our session. Now we move forward. Another story describing an homeless alcoholic who, with these eating habits, eating out of trash cans, and now she comes to a doctor with bleeding and inflated gums. There are also some neurological problems such as fatigue, muscle weakness, irritation, depression. And now if you can link some or all these problems to a molecular level, now where could be the problem here? It's obviously related somehow to metabolism of collagen. And I know you have my presentation now, and you might be tempted to go look on the correct answer, but instead try to make a decision. And I'm relaunching the poll. You should be able to respond. If it disappears, if the poll disappears, you can always call it back by clicking on the polls icon in the Zoom software, right? So I will let you think shortly about the most probable explanation on the molecular level if you consider the eating habits of that individual. And the interesting thing is that all this information that is necessary to make your decision was definitely provided in all the histology presentations from the beginning of the semester. I double checked that, and if you go to the Moodle course where all the histology presentations are free, are prepared for download and your study, all the information you need was there. And it's also on our YouTube channels in these schemes. So actually, technically, everybody should be able to answer that if you really got the point. And it's also in most histological textbooks. These are like classical problems. So I see most of the students have already voted. I will end the polling so we can go to other questions. That's great. I will share the results with you. So you should see that most students picked D, and it's indeed correct, because that's what happens in individuals lacking from insufficient supply or resorption of vitamin C. Now we should know that the vitamin C is a cofactor of enzymes that are hydroxylating these amino acids. They are coded in the collagen molecules, but they are modified to hydroxyproline and hydroxylase by these enzymes, prolyl hydroxylase and lysyl hydroxylase. So without vitamin C, and you really can't get much vitamin C when living from the trash cans and perhaps consuming alcohol, you cannot produce these amino acids. And the hydrogen bonds that are among these amino acids are responsible for the stabilization of the collagen, tropocollagen molecules, which have a form of triple helices of 3 collagen molecules wrapped around each other. And they need these hydroxylated amino acid to form the hydrogen bonds to become really mechanically stable. So without vitamin C, you cannot these enzymes don't work properly, and the molecules are not stable, which is the molecular background of a disease called scurvy. And this is just to remember one of the real, I would say, modern type experiments performed in the history of medicine, where this naval physician administered to the sailors suffering from scurvy. He administered them what was believed in these times to cure or prevent scurvy, such as cider, sulfuric acid, seawater, some spices and vinegar, and only the patients with vitamin C supply recovered and were fine. So that's how it was proved. Another problem. Think about a situation. A young lady is driving her car, and now she has some blurred visions. She has a double vision. She needs to stop the car. She starts suddenly. She has difficult speaking. Yeah, trouble speaking. This is called dysarthria in medicine. She complains of feeling sick. And you know that she visited a farm where her grandmother is preparing some home canned food. And really, you find the patient has diplopia, which is this blurred vision, difficult speech articulation. Ptosis, this is when the eyelids are falling down, closing your eyes, and paralysis of the facial muscles. You will examine the cerebrospinal fluid, and you will find the protein levels is normal. Now, what could be the explanation for that? This becomes a little bit difficult. But I will let you vote again. And again, this was mentioned in one of our lectures, I believe. So are these problems somehow could they be explained by one of these conditions? You might not know some of the words. Feel free to Google it out. You will definitely hear that later on in pathology or in neurology in this case. So it makes no harm to make familiar with these terms even in the first year. I will wait a few moments more. Okay, I'm ending the polling, sharing the results with you, and you can see most students voted for C, which is actually correct. You can go through the other problems, but this is clearly botulism, which is the intoxication with a toxin called botulotoxin, which is a product of a bacterium called Clostridium botulinum. And here is explanation why it was not the other option like stroke and so on, why it was not the tick-borne encephalitis, because the symptoms appear like 3 weeks after the infection. And I go back to the botulin problem. The toxin of this released by this bacteria has like more subunits, and some of this is decomposing the so-called snare proteins. And these snare proteins are vital for correct vesicular transport. And if the transport of vesicles with acetylcholine, which is the neurotransmitter on the motor end plate, connecting or transmitting the signal from a motor neuron to a skeletal muscle fiber, so the muscle fiber cannot be activated, right? So there is a paralysis of muscles. That's why she had blurred vision, because for correct vision, you need precise cooperation of the muscles of the eyeball. That's why she had facial paralysis. The difficult formation of speech, because you need many muscles to articulate your speech. Okay. Sorry. Let's go to another problem. This will be easy for you, I believe. You already know that the troponin I is one of the biochemical markers of an acute myocardial infarction. Why is that? Because if you find this molecule in the blood plasma, it's obvious it must have come from some cardiac muscle cells that suffered a damage, such as during ischemia. Yeah, that's the background for myocardial infarction. Now, pick out the correct or the best description what the troponin I actually does and how is it organized in the cardiac muscle cells. Which of these statements might be correct? Which describes the localization and the function of troponin I at the best? And the question is specifically about one of the 3 subunits of troponin, troponin I. And again, if you remember our class on muscle tissue, this should be a piece of cake for you. Okay, I can see most of you have voted. Again, if you have technical problems, just click on the pause icon that is in the Zoom software controls, okay? So I will end the polling shortly so we can manage more problems. So I don't see any more responses coming. So let's have a look. So most of you voted for D. I'm glad to hear that, because that's really how the troponin is organized. It binds on the actin molecules. This is the G or globular actin, the polymerization of which forms the fibrillar actin, and all together with the tropomyosin and troponin that makes the muscle actin microfilaments. And the troponin T is called T because it binds to tropomyosin, that's this ribbon molecule here. And the troponin C is called C because it binds to calcium ions that triggers the muscle contraction. So even these letters indicate some the explanation of it. Troponin I inhibits the binding of actin to the myosin. And here you can see how really these days the increased levels of troponin are part of the diagnostic scheme for assessing patient with acute myocardial ischemia. Yeah, together with the electrocardiogram and clinical symptoms, it's part of the decision process. Hours after the onset of the myocardial ischemia, that's lack of oxygen delivered to muscle cells, you can see the increase of troponin I and T. That's why it's used. It's also other biochemical markers are myoglobin, for example, or the creatine kinase, which is one of the muscle enzymes, and especially an isoenzyme forms more specific for cardiac muscle. Okay. Another problem. So you can vote again. Let's consider a football player who had a knee injury, and he underwent removal of part of the medial meniscus, you know, the menisci from the anatomy. And now we care about the histological description of that tissue that has been removed. Now, which of those statements does characterize the tissue in the best way? Now the polling should be active and available for you. So you definitely need to know what type of tissue makes these menisci, right? And again, this is for you to have some feedback. The poll is anonymous. I cannot see who responded this way or that way. So try not to use the hints that are on the next slides, but rather try to really elaborate the question. So if I were, for example, in your position and I would be completely lost, I would just Google out something like meniscus and histology. And in a few seconds, I know what type of tissue can be found there. And if I know what type of tissue is that, that's a great help to make a decision, yeah, to pick the single best answer here. So I will wait a few more seconds until I have the majority of students given their votes. And I see some students still do not vote, like 5 to 6 students usually don't vote. If you have any technical issues or problems that prevent you from voting, just type it to me to the chat, okay? I always wonder about why some students don't use that opportunity to have this feedback. Okay, I will end the polling. I see over 70% of students have already voted. So you can see most students voted for E, perhaps by excluding the other options. What was the key to this answer? You should know that the structures like articular discs or menisci are made of fibrous cartilage. This is a picture of that fibrous cartilage. You can see it's mostly made of collagen, these thick bundles of collagen. That's type 1 collagen. The cells, chondrocytes, are really scarce here and mostly occurring as single cells, single chondrocytes, and only sometimes they form small isogenous groups made of 2 cells, 3 cells, but they are not these large isogenous groups like in hyaline cartilage, right? So this is a fibrous cartilage, type 1 collagen, few chondrocytes. And this fibrous cartilage lacks perichondrium, where it's an intra-articular structure, isn't it? It's inside the knee joint. There could not be any perichondrium. Imagine what would happen if there would be perichondrium. Then the movement, first few movements, would destroy that perichondrium by friction. So you don't have perichondrium on intra-articular cartilage. Either it's the knee cartilage here, there's the hyaline one on the condyles, or the fibrous cartilage of the menisci. Instead, the nutrition is provided by the synovial fluid that is produced by the inner layer of the knee joint capsule. Yeah, the inner layer is the synovial layer that produces some viscous fluid providing the nutrition. So this is to remember fibrous cartilage constitutes the menisci. By the way, that's why these structures have a very poor regeneration in adults, because you can see there are no blood vessels there. And if there are no blood vessels, then any injury has a poor chance to heal, because the tissue cannot regenerate without blood vessels. And we know that the cartilage tissue is avascular. Yeah, we know that. Another point, another situation. There is a man in his 30s that has a paralysis. Now, paralysis is the loss of function of the muscles. Spastic type suggests that from the 2 motor neurons that are ruling your muscle activity, your skeletal muscle activity, I mean the first neuron being in the motor cortex of your brain, and the second neuron being in the anterior horns of the spinal cord. Now, if the first neuron is damaged, then you have increased muscle spasm. Yeah. When the second neuron in the spinal cord is damaged, then you have a flaccid low condition of your muscles with low muscle tone. That's why how you can judge which of these 2 neurons was damaged. There is visual impairment, fatigue, Now he undergoes some imaging procedure. Mostly it's magnetic resonance imaging. That is the method of choice when it comes to nerve tissues, because it offers high contrast there in these soft tissues. And you can see there is a loss of myelin in some parts of the brain. Now, which cells, and I'm relaunching the polling now, which cells are producing the myelin here? And again, this is a very simple question. And when we discuss these glia cells, you need to pick up one of these neuroglia cells, okay? When we discuss these glia, I believe we have mentioned the function of every single glia type here. So this should be very easy for you. Okay, I can see most of the students have already voted. So is the oligodendrocytes, yeah? I can see some students believe it's Schwann cells, but you know that it's in the brain. Is the brain hemisphere mentioned here. So Schwann cells are also producing myelin, but in the peripheral nervous system. If we're discussing here the brain, we're discussing the oligodendrocytes that are producing the myelin. This is a central type of myelin, which has even a little bit different composition than the myelin in the peripheral nervous system. So you can see most students pick the right answer, the C. So this is to remember this condition really exists. It's called multiple sclerosis. You can see an MRI picture that shows you the foci where the lesions where the myelin was lost, and there is an inflammation running here. It's an autoimmune disease that destroys the myelin anywhere in the brain or in the spinal cord. That's why it's called multiple sclerosis, because it can occur anywhere. And the loss of myelin, of course, affects the ability of these tracts to propagate action potentials, to propagate information, and therefore it can present with multiple symptoms you will discuss in other medical disciplines. So from the first year histology, always remember oligodendrocytes are producing myelin, and myelin is vital for proper function and of the nerve processes for the proper propagation of action potentials, yeah, in myelinated fibers. Again, we have another topic here, and I will relaunch the polling. You have a chronic alcoholic. He is unstable in motion and in gait, lacks coordination of movements. MRI, magnetic resonance imaging, tells you there is a degeneration of the vermis part of the cerebellum. Now, which of these cells could be probably destroyed in this patient? And I'm sure you have heard about these cells when we discussed the histology of cerebellum. There are many types of neurons in the human body. You're not expected to know all of these, but some cells are so significant that every student is expected to know where they are. Not speaking about the fact that in the second year physiology, you will discuss the wiring schemes of the cerebellum, and you will definitely need to know all these cells. So I see all the students picked the correct answer. Yeah, all the students voted for D, which is correct. These are Purkinje cells. These are the large flask-shaped neurons in the second layer of the cortex of cerebellum, first, second, third layer. Yeah. Now the dendrites of these Purkinje neurons are spread in the first layer, that's the molecular layer, and they receive many afferent stimuli, while the axon runs through the granular layer into the white matter of the cerebellum and goes to the nuclei of the cerebellum. They're mostly inhibitory neurons, these Purkinje cells, and without the Purkinje cells and their functions, you cannot do coordinated movements. And this is what really happens. This is one of the consequences of chronic alcoholism, the damage to the cerebellum, the atrophy, the loss of volume, loss of these cells. So there are many adversary effects of chronic alcoholism, and this is one of these. There are more neurological symptoms also caused by the B1 deficiency, because alcohol impairs uptake from the B1 vitamin from the GIT, and has other adverse effects. And the last question here would be, you're looking on a histological slide of human brain. This is the brain cortex. You can see the 1, 2, 3, 4, 5, 6 histological layers of the brain cortex. Now, which of the cortical areas are you probably looking at? And I believe this could be the most difficult problem for you, because the structure of the human brain cortex is very complicated, and various regions of the brain have various cytoarchitectonics, diverse proportions of these 6 layers. And I'm not sure if we have mentioned this one. This is exception question. This is just for students who really carefully read textbooks on nerve tissue. And it's also important feedback for me if you're reading the chapters from the general histology. So I will go to a solution. In this case, the A was the correct answer. How could you know? I hope you noticed that the thickest lamina, the layer, is the number 3 here. And this is typical for the association cortex. Now, it's in the prefrontal lobes of your brain. These are the areas responsible for social intelligence, for empathy, for handling the situation in social interactions, right? And they have they're characteristic by having really well developed layer 3. I have completed a short review what the other layers are containing and what they are connected to. And well, as nobody these days knows the real wiring of all the neurons, there are still some major connections that are important when it comes to damage of some of these brain regions and layers. Yeah, you can see the motor cortex has a especially well-developed layer number 5. So if the layer number 5 would be very thick, you could guess it must be from the motor cortex. Or sensory cortex or special sensory cortex. These layers, these regions of human brain have especially well developed the 4th layer. That's the internal granular layer with the small granular neurons. Yeah. the motor layer has these large motor neurons. I believe you can even see these large motor neurons. They have a pyramidal shape in the layer number 5 and in the layer number 3. Yeah, which is so that's just a short window into the cytoarchitectonics. Now, this was to provide you some feedback on this general histology. I hope you enjoy it. Next time, we have 2 more lectures coming in the semester. Next week, we will discuss blood vessels, heart, and lymphatic system, because we are already leaving the simple tissues, and now we will combine everything with everything. We go into histology of real organs, and although the majority of this systematic histology will be explained in the 2nd year, we already want you to practice the systematic histology starting with blood vessels, because it helps you to integrate the general histology knowledge you acquired in the semester, and it gets you used to look on all components of the tissues at the same time, bringing it into context where you will really need it. So next week we'll discuss circulatory system, and the week after that, we will discuss the endocrine, the histology of endocrine organs. Then comes the credit exam and the vacations, and then in the 2nd year histology we'll carry on with more systematic approach, going from organ to organ through all the organ systems of the human body, like GIT, respiratory, male reproductive system, female reproductive system, urinary system, and so on. So thank you for working together. And if now I'm ending the official part with the recording, I'm stopping the recording now.